If you truly value your health, your confidence, and the future you want as a man, then I encourage you to stay with me until the very end of this conversation. What I'm about to share has the potential to spare you from years of unnecessary frustration, and, in some cases, it could even help protect your life. That may sound like a bold statement, but let me ask you something honestly. Have you ever noticed a small change in your body, convinced yourself it was probably nothing, and decided to ignore it? Most men have. The problem is that when those changes involve your erections or your sexual health, they are very rarely meaningless. Your body is trying to communicate with you. Unfortunately, many men dismiss those early warning signs until the problem becomes much harder to reverse. Today, I want to walk you through 10 things you should never do to your penis. These are everyday habits, common mistakes, and overlooked behaviors that slowly damage erectile function while quietly affecting your confidence without you even realizing it. By the time we've finished, you'll understand exactly what to avoid, what your body may already be trying to tell you, and how to protect healthy erections while maintaining an active and satisfying intimate life at any stage of adulthood. Leave your country or city in the comments because it's always encouraging to see men from different parts of the world learning together and supporting one another. And if you appreciate practical medical advice based on science instead of myths or internet rumors, don't forget to like this video and subscribe. My goal is to help you make informed decisions about your health with confidence. Now let me tell you something that many men never hear, even during routine medical appointments. Your penis is not separate from the rest of your body. In many ways, it reflects your overall health. Think about what an erection actually requires. Healthy blood vessels must deliver enough blood. Your nerves must send clear signals. Your hormones need to be balanced. Your brain and emotions must work together without excessive stress getting in the way. If any one of those systems begins to struggle, one of the first places you'll often notice the difference is in your erections. That's why when I tell you not to make certain mistakes with your penis, I'm not speaking only about sexual performance. I'm talking about your circulation, your hormones, your cardiovascular system, and ultimately, your long-term well-being. Research has repeatedly shown that men who develop erectile dysfunction have a significantly higher chance of experiencing heart disease, stroke, diabetes, or other metabolic conditions in the years that follow. In other words, your penis often acts like the warning light on the dashboard of a car. When that light turns on, ignoring it doesn't solve the problem. It simply allows the condition underneath to become worse. The earlier you pay attention, the better your chances of protecting not only your sexual function, but your overall health as well. If this is your first time watching one of my videos, welcome. I'm Dr. Rose, a board-certified urologist, and for many years I've dedicated my career to helping men preserve their health, rebuild their confidence, and continue living strong, active lives as they grow older. Throughout my years in clinical practice, I've met men from every stage of adulthood. I've treated men in their 30s who became worried because they noticed reduced sensitivity or weaker erections for the first time. I've spoken with men in their 60s who feared their intimate life had permanently come to an end. I've also cared for men well into their 80s who reminded me every single day that vitality does not belong only to youth. One lesson has remained remarkably consistent across every age group. The men who continue enjoying healthy, fulfilling lives are not necessarily the strongest or the luckiest. They are usually the ones who understand their bodies. They recognize warning signs early. They avoid unnecessary risks. They take small preventive steps before minor issues become major problems. Knowledge truly changes outcomes. Knowing what deserves attention, understanding which habits quietly cause harm, and learning how to care for the body you've been given can make an extraordinary difference over time. So let's begin with the first and perhaps the most important mistake you should never make. The first thing you should never do is ignore changes in your penis. If there is only one message you remember from today's discussion, I hope it is this one. When your erections begin to feel weaker than usual, when you notice that morning erections happen less often, or when sexual arousal simply feels different from what you've experienced throughout most of your life, don't automatically assume it's just part of getting older. While aging certainly influences the body, these changes often have biological explanations that deserve attention. They may indicate that your blood vessels are becoming narrower, reducing healthy blood flow. They could suggest that your nerves are becoming less responsive. They may even point toward changes in hormone levels or early cardiovascular disease that has not yet produced obvious symptoms elsewhere. Emotionally, ignoring these warning signs can slowly affect far more than your physical health. Many men begin questioning themselves in silence. They avoid intimacy because they fear disappointment. They make excuses to distance themselves from their partners. Some even begin believing that their masculinity is fading, when in reality, their body is simply asking for help. The good news is that early action often leads to better outcomes. Pay attention to what your body is telling you. Notice patterns instead of isolated events. If something continues for several weeks or repeatedly concerns you, schedule an appointment with your doctor rather than waiting months or years hoping it will disappear on its own. In medicine, identifying a problem early often gives us far more options for treatment and, in many cases, allows us to prevent further decline before lasting damage occurs. The second mistake you should never make is believing dangerous home remedies that promise quick results. This is something I wish I never had to discuss, but unfortunately, I see the consequences far too often in my practice. Many men become frustrated when they notice changes in their erections, and instead of seeking proper medical advice, they begin searching the internet for miracle solutions. They come across videos, advertisements, and anonymous forums claiming that homemade treatments can enlarge the penis, restore erections overnight, or dramatically improve sexual performance. Some men apply substances that were never meant to touch such sensitive skin. Others use homemade vacuum devices, bottles, heavy weights, or tight metal rings, believing these methods are harmless because someone online claimed they worked. The reality is very different. From a medical perspective, these practices can seriously injure the delicate nerves, blood vessels, and tissues that make normal erections possible. I've treated men who developed severe swelling, painful bruising, permanent scarring, and even irreversible erectile dysfunction after experimenting with these so-called natural solutions. In some situations, emergency surgery became necessary simply because they trusted misinformation instead of science. Behind these choices, however, there is usually something much deeper than curiosity. Most men are not reckless. They are worried. They are embarrassed. They compare themselves to unrealistic images and begin believing they are somehow inadequate. Let me reassure you of something important. Most of those fears are based on myths, not medical facts. Before trying any product, device, or technique that promises impossible results, stop and ask yourself whether it has been studied, tested, and recommended by qualified medical professionals. If the answer is no, it is simply not worth risking your long-term health. When treatment is actually needed, there are safe, evidence-based options available. Your body deserves proper care, not dangerous experiments that could leave permanent damage. The third mistake is neglecting personal hygiene. At first, this may seem too simple to matter, yet it remains one of the most common issues I encounter, especially among uncircumcised men. Good hygiene is not about appearance alone. It plays a direct role in preventing infections and protecting the health of the skin and surrounding tissues. Throughout the day, natural oils, sweat, bacteria, and dead skin cells gradually collect around the genital area. For men with a foreskin, this material can build up underneath if it is not cleaned regularly. Over time, that accumulation creates an environment where bacteria and fungi can multiply. Medically, this increases the risk of irritation, inflammation, unpleasant odor, painful infections, and conditions such as balanitis. In rare but important cases, years of chronic inflammation have even been associated with an increased risk of penile cancer. Beyond the physical effects, poor hygiene often affects emotional well-being as well. Many men begin feeling embarrassed during intimate moments. They become self-conscious about odor or discomfort and gradually start avoiding closeness with their partner. Fortunately, preventing these problems is remarkably straightforward. During your daily shower, gently wash the genital area using warm water and a mild, fragrance-free cleanser if needed. If you have a foreskin, carefully retract it, clean underneath without scrubbing aggressively, rinse thoroughly, and make sure the area is dry before replacing the foreskin. Avoid harsh soaps, strong chemicals, or excessive rubbing because sensitive skin can easily become irritated. Think about it the same way you think about brushing your teeth. A few minutes of consistent care every day can prevent much larger problems in the future. The fourth mistake is ignoring pain, bleeding, unusual lumps, or any visible change that seems abnormal. Let me say this as clearly as I can. Your penis should not hurt without a reason. Persistent pain is never something you should simply accept as part of aging. The same is true for bleeding, sores, ulcers, firm lumps beneath the skin, changes in shape, or blood appearing in the urine. These symptoms deserve medical attention because they may be warning signs of conditions that require timely treatment. Sometimes the cause is relatively simple, such as an infection that responds well to medication when diagnosed early. In other cases, the explanation may involve kidney stones, Peyronie's disease, sexually transmitted infections, or, in rare situations, cancer. The important point is that no one can determine the cause without proper evaluation. Emotionally, many men stay silent because they hope the symptom will disappear on its own, or because they feel embarrassed discussing such personal concerns. Unfortunately, delaying medical care often increases anxiety while allowing the underlying condition to progress. In medicine, time matters. Problems that are relatively easy to manage in their early stages frequently become much more complicated after months of neglect. Seeking help is not a sign of weakness. It demonstrates maturity, responsibility, and respect for your own health. If you notice something that feels unusual or simply doesn't seem right, don't convince yourself to wait indefinitely. Let a qualified healthcare professional examine the situation and provide clear answers. Peace of mind is valuable, and when treatment is necessary, early intervention almost always offers the best chance for a successful outcome. The fifth mistake is losing control during sexual activity. Passion is a wonderful part of intimacy, but it should never come at the expense of safety. Many people don't realize that a penile fracture is a real medical emergency, and although it is uncommon, I have treated patients who experience this frightening injury. Despite the name, there is no bone inside the penis. Instead, a penile fracture occurs when the tough outer layer surrounding the erectile tissue suddenly tears while the penis is fully erect. This usually happens because of a forceful bend during vigorous intercourse or another accidental movement. Men often describe hearing or feeling a sudden popping sensation, followed immediately by intense pain, rapid swelling, bruising, and an immediate loss of the erection. Physically, this injury almost always requires urgent surgical treatment to repair the damaged tissue. Delaying medical care greatly increases the risk of long-term complications, including permanent curvature, erectile dysfunction, and persistent pain. Emotionally, the experience can leave lasting fear that affects future intimacy long after the physical injury has healed. Fortunately, there are practical ways to reduce this risk. Good communication with your partner, staying aware of body position, avoiding sudden uncontrolled movements, and using adequate lubrication whenever needed all contribute to safer and more comfortable intimacy. Remember, healthy sexual relationships are not measured by speed or intensity. They are built on trust, comfort, mutual respect, and paying attention to each other's well-being. Slowing down does not reduce pleasure. In many cases, it actually improves the overall experience while protecting your health for years to come. The sixth mistake you should never make is exposing your testicles to excessive heat for long periods of time. Many men don't realize that the position of the testicles outside the body serves a very important biological purpose. They are designed to stay slightly cooler than your normal body temperature because that cooler environment is essential for healthy sperm production and the natural production of testosterone. When the scrotum is exposed to constant heat, those delicate processes begin to suffer. Spending long periods in hot tubs, sitting in very hot saunas several times a week, resting a laptop directly on your lap for hours, or regularly keeping heat-producing electronic devices pressed against the groin can gradually increase scrotal temperature. While a single exposure is unlikely to cause lasting harm, repeated habits over months or years may affect reproductive health. Biologically, elevated temperatures can reduce sperm count, decrease sperm quality, and interfere with the cells responsible for producing testosterone. Lower testosterone levels may not happen overnight, but when they develop, many men begin noticing subtle changes that slowly become more obvious. You may feel tired even after a full night's sleep. Your motivation may decline, your mood may become less stable, and your interest in intimacy may decrease without any clear explanation. Many men assume these symptoms are simply part of getting older, when in reality, lifestyle factors may be contributing more than they realize. The practical solution is simple. Be mindful of unnecessary heat exposure. Take breaks if you spend long hours sitting. Use a desk or table instead of placing a laptop directly on your lap. Limit prolonged exposure to extreme heat when possible, and wear comfortable underwear that allows proper airflow instead of clothing that constantly traps excessive warmth. Small adjustments like these can help preserve your reproductive health and support healthy hormone levels well into the future. The seventh mistake is being too aggressive during masturbation. This is a topic many men rarely discuss openly, yet it is far more common than most people think. Masturbation itself is a normal and healthy part of human sexuality. The problem is not the activity. The problem is the way it is sometimes performed. Over time, repeatedly using excessive pressure, gripping too tightly, or relying on one very specific technique can train the nervous system to respond only to that type of stimulation. In urology, this pattern is often referred to as death grip syndrome. Although it is not an official medical diagnosis, it accurately describes what many men experience. Biologically, your brain and your nerves adapt to repeated patterns. If your body becomes accustomed to unusually intense stimulation, normal intimacy with a partner may no longer provide the same level of sensation. As a result, erections may become harder to maintain during intercourse. Ejaculation may take much longer than expected, or it may not happen at all, despite adequate desire. Emotionally, this can become extremely frustrating. Many men mistakenly believe something is seriously wrong with their bodies, or that they are losing attraction to their partners. In reality, the issue often involves learned patterns that can be changed with patience and consistency. The practical approach is to slow down, avoid rushing. Use a quality lubricant to reduce unnecessary friction. Vary your technique instead of repeating the exact same movement every time. Allow your body to experience different types of stimulation so that your nervous system remains flexible rather than becoming dependent on one specific habit. Healthy sexuality is based on adaptability, not repetition. Teaching your body to respond naturally will often improve both solo experiences and intimacy with your partner. The eighth mistake is continuing to smoke while neglecting the rest of your overall health. If I had to identify one lifestyle habit that consistently damages erectile function faster than many men expect, smoking would be near the very top of the list. Every cigarette exposes your blood vessels to chemicals that gradually injure their inner lining. Healthy erections depend entirely on healthy circulation. When blood vessels become narrowed, stiff, or damaged, they cannot deliver the amount of blood required to achieve or maintain a firm erection. The effects usually develop slowly, which is why many smokers fail to notice the connection until significant problems appear. Beyond erectile dysfunction, smoking also increases the risk of bladder cancer, kidney disease, heart attacks, strokes, and countless other medical conditions that affect both quality and length of life. Emotionally, many men feel shocked when they realize that a habit they viewed as manageable has quietly affected one of the most personal aspects of their health. They often tell me they never imagined cigarettes could influence their confidence, relationships, or intimate life. The encouraging news is that the body has an incredible ability to recover once harmful habits begin to change. Quitting smoking improves circulation over time and benefits nearly every organ in the body. At the same time, regular physical activity strengthens your cardiovascular system, nutritious meals support healthy blood vessels, maintaining a healthy weight improves hormone balance, limiting alcohol protects nerve function, and managing stress allows your brain and body to work together more effectively. Remember this important principle: healthy erections are not separate from a healthy lifestyle. They are one of its natural rewards. Every positive decision you make for your heart also benefits your sexual health. Every step toward better overall wellness is also a step toward protecting your confidence, your energy, and your future. The 9th mistake you should never make is being too hard on yourself. This is one of the most overlooked problems affecting men's sexual health, because many men focus only on physical causes while ignoring the powerful connection between the mind and the body. I have spoken with countless patients who believed that one difficult experience, one weaker erection, or one moment of anxiety meant something was permanently wrong with them. They began carrying fear into future intimate moments, constantly asking themselves, "Will it happen again?" That single thought can create a cycle that becomes harder to break. The truth is that every man can experience occasional difficulties, stress, exhaustion, relationship tension, emotional pressure, and many other temporary situations can affect sexual performance. Having an off day does not mean you have failed. It does not mean you are less of a man. It simply means you are human. From a biological perspective, stress has a direct effect on sexual function. When your body is under pressure, it releases hormones such as cortisol and adrenaline that prepare you for danger rather than intimacy. Your brain begins focusing on survival instead of pleasure and connection. This natural response can make arousal more difficult and interfere with erections. Emotionally, the problem becomes worse when men respond with shame, anger, or self-criticism. Instead of solving the issue, negative thoughts increase anxiety, and anxiety creates even more difficulty the next time. It becomes a frustrating cycle where fear creates the very problem you are afraid of experiencing. The practical solution begins with changing the way you speak to yourself. Treat yourself with the same patience and understanding you would offer a close friend. If something concerns you, discuss it openly with your partner or a trusted healthcare professional. Communication removes pressure and creates support. Remember, your value as a man is not measured by a single performance. Your confidence, your character, your ability to love, and your ability to connect with others matter far more than one moment in the bedroom. A healthy mindset is an important part of a healthy sexual life. Now let's talk about the 10th and final mistake you should never make: completely ignoring your sexual health and assuming that using it less means it will simply disappear. Many people have heard the phrase, "use it or lose it." And while this saying is often oversimplified, there is some truth behind the importance of maintaining erectile function. Erections are not only about sexual activity, they are also a natural biological process that helps maintain healthy tissue, oxygen flow, and flexibility within the penis. When erections become extremely rare for long periods, changes can occur within the erectile tissue. Reduced blood flow may contribute to stiffness of the tissues, and in some cases, scarring or loss of elasticity may develop. Over time, this can make achieving strong erections more difficult. However, maintaining sexual health does not mean forcing yourself into unrealistic expectations or feeling pressured to perform. It means understanding your body and keeping the systems involved in sexual function active and healthy. Emotionally, intimacy represents much more than physical activity. It is connected to affection, emotional closeness, confidence, and the bond between partners. Many men mistakenly believe that sexual health stops being important as they age, but that is not true. A healthy, intimate life can continue throughout adulthood when approached with realistic expectations and proper care. Whether through intimacy with a partner or healthy personal stimulation, maintaining awareness of your sexual function helps you notice changes earlier and take action when necessary. The goal is not obsession. The goal is balance. Respect your body, understand your needs, and protect your health. So after learning these 10 important points, what should you actually do moving forward? Start by becoming more aware of your body. Notice changes instead of ignoring them. If something feels different, write it down and discuss it with a medical professional when needed. Avoid dangerous internet remedies that promise unrealistic results. Trust science and proven medical approaches. Maintain proper hygiene every day because small habits prevent larger problems. Never ignore pain, bleeding, unusual lumps, or other warning signs because early evaluation can make a significant difference. During intimacy, prioritize safety, communication, and comfort. Use lubrication when appropriate and avoid unnecessary risks. Protect your testicles from excessive heat and support healthy hormone function through smart lifestyle choices. If you masturbate, do so in a balanced and mindful way, rather than creating habits that may negatively affect sensitivity. Take care of your heart, because your cardiovascular health and erectile health are closely connected. Exercise regularly, eat nutritious foods, manage stress, and avoid harmful substances that damage circulation. Most importantly, treat yourself with compassion. Your body does not need criticism. It needs attention, patience, and care. Let me remind you of something important. The need to change certain habits does not mean your body is broken. It means you have gained enough knowledge to make better decisions. The human body is constantly responding to the way we treat it. When your body sends you a warning sign, it is not your enemy. It is communicating with you. It is asking you to pay attention before a small issue becomes a major one. Many men spend years worrying that they are losing their strength, their confidence, or their identity as they age. But the truth is very different. Confidence, intimacy, and dignity do not disappear simply because time passes. In many cases, they become stronger when combined with wisdom and self-awareness. A man who understands his health is a man who can protect his future. Starting today, I want you to make a commitment to yourself. Protect your erections the same way you protect your heart, your brain, and your overall well-being. Do not separate these areas because they are deeply connected. Your circulation, your hormones, your emotions, and your lifestyle all work together to influence your health. You deserve to feel strong, capable, and confident, not only in your intimate life, but in every part of your daily existence. If this information helped you understand your body better, consider sharing it with another man who may be silently dealing with similar concerns. Sometimes one honest conversation can change someone's life. Many men suffer quietly because they feel embarrassed to ask questions, but education removes fear and replaces it with confidence. Remember, getting older does not mean losing vitality. The choices you make today can influence how you feel tomorrow. Small improvements, consistent care, and informed decisions can help you maintain comfort, freedom, and confidence for years to come. Before we finish today, I want you to take a moment and think about the bigger message behind everything we discussed. Your sexual health is not something separate from the rest of your life. It is connected to your choices, your habits, your emotions, and the way you care for yourself every single day. Many men wait until a serious problem appears before they begin paying attention, but your body has been giving you information all along. The small changes you notice are often opportunities to act, not reasons to panic. A weaker erection, a change in sensitivity, reduced desire, or discomfort does not mean your best years are behind you. It means your body is asking you to listen. The strongest thing a man can do is not ignore problems or pretend everything is fine. True strength comes from awareness, responsibility, and the willingness to take action when something needs attention. I have spent years speaking with men who carried unnecessary fear and embarrassment because they believed they were the only ones facing these challenges. They thought no one else experienced changes in their sexual health. They thought asking for help was a sign of weakness, but the reality is completely different. Millions of men experience concerns related to erections, hormones, confidence, and intimacy at different stages of life. The difference between men who continue to struggle and men who regain control is often not luck. It is the decision to stop hiding, stop believing myths, and start making informed choices. Medical science has advanced tremendously, and today there are more ways than ever to understand and improve men's health. The first step is always awareness. Remember the important lessons we covered. Do not ignore the signals your body gives you. Do not trust dangerous shortcuts that can create permanent damage. Do not neglect basic hygiene, because small daily habits protect you from bigger problems later. Do not ignore pain, bleeding, or unusual changes, because early attention can make treatment easier and more successful. Do not put yourself at unnecessary risk during intimacy, because protecting your body also protects your future. Be mindful of habits that affect your hormones and fertility. Treat your body with respect during sexual activity. Protect your circulation by taking care of your heart. And above all, do not allow shame or fear to control your decisions. Your health journey is not about becoming perfect. It is about becoming more aware. Every positive change you make matters. Choosing to walk more often, eating better foods, sleeping properly, reducing stress, quitting harmful habits, and having honest conversations with healthcare professionals are all investments in the man you want to become. Many people underestimate the power of small daily decisions because they are looking for dramatic solutions. But in medicine, the greatest improvements often come from consistent actions repeated over time. Your body responds to the care you provide. When you protect your health today, you create a better tomorrow. I also want to address something that many men quietly struggle with: the fear of aging. Society often sends the message that youth is the only time when a man can feel confident, attractive, and powerful. That message is simply not true. Aging does not mean losing your identity. It does not mean losing your ability to experience connection, affection, or intimacy. In many ways, maturity brings advantages that youth cannot provide. Experience, emotional understanding, self-awareness, and confidence built through life all contribute to a deeper and more meaningful relationship with yourself and with your partner. Your body may change with time, but change does not equal decline. With the right knowledge and care, many men continue enjoying a healthy and fulfilling intimate life for decades. So my challenge for you is simple. Starting today, stop treating your sexual health as something embarrassing or something that should only be discussed when there is a crisis. Make it part of your overall health routine. Pay attention, ask questions, seek professional advice when needed. Protect your body with the same seriousness you would give to any other important part of your life. Your heart keeps you alive. Your brain controls your experiences. Your relationships give your life meaning. And your sexual health is one more part of the complete picture that makes you who you are. If this information helped you, I encourage you to share it with someone who may need to hear it. There are many men silently struggling because they are afraid to speak about these topics. A simple conversation or a helpful video can sometimes be the first step towards someone getting the support they need. Never underestimate the impact of sharing knowledge. You may help another man recognize a warning sign, avoid a harmful mistake, or finally feel comfortable seeking medical advice. And remember this: your body is not working against you. It is always communicating with you. When you respect those signals, you give yourself the opportunity to live with more confidence, more energy, and more peace of mind. Protecting your health is not about fear. It is about freedom. It is about enjoying life, maintaining meaningful connections, and feeling comfortable in your own body. Thank you for spending this time with me. I'm Dr. Rose, and my goal is always to help you understand your health with honesty, science, and compassion. Take care of yourself, because your health matters, your confidence matters, and you are worth the effort. I will see you in the next video.